The St. Lucia Labour Party is appalled, but not surprised, at the callous and uncaring manner that the government of the United Workers' Party continues to treat healthcare for the citizens of St. Lucia. After nearly 2 years in power, the state of health services in the country has never been worse. The government has failed to give any meaningful leadership or direction to the health services. When the UWP gained power, they found the St. Jude's Hospital under construction and nearing completion. Instead of continuing work on the building, the government embarked on what can be considered the biggest con ever inflicted on a nation. The UWP commissioned a $1 million audit and have kept the report a secret. The contents of a handover report prepared by the project manager was concealed until it was leaked by the public. Then the Minister of Economic Development goes on a rampage of lies and misinformation to deceive the public on his true intentions as far as St. Jude Hospital is concerned. To add to the deliberate confusion, ministers make contradictory statements on the St. Jude Hospital. The latest being that the structure would be handed over to a foreign concern to house a medical school. The St. Lucia Labour Party is concerned about the callous disregard for the views opposing such a plan from recognized institutions, health professionals, and the public in general. Once again, we are calling on the government not to pursue such a plan of action, and warns that we will employ all legal means to stop such reckless action. The money donated by foreign governments to St. Lucia for St. Jude Hospital was not intended to be given to a private sector firm as a means of generating private profits. The donations from St. Lucians, both at home and abroad, were not made to be gifted to a foreign concern. The St. Lucia Labour Party believes that this course of action shows contempt, recklessness, and irresponsibility of a heartless government. While the government continues to be indecisive and uncaring, the state of healthcare in St. Lucia, particularly in the south, continues to worsen. Despite the best efforts by the hardworking doctors and nurses to deliver quality health services, citizens are dying due to the horrible conditions that the government has allowed to prevail at the stadium. What government would allow people to receive inadequate health care in a temporary facility while a hospital building under construction is kept closed for 2 years and is about to be handed to a private concern? The St. Lucia Labour Party's position remains: no privatization, no alternative use, continue work on the hospital immediately. The people of St. Lucia are at a loss regarding the privatization of the OKEU hospital. Our position is clear. There should be no privatization of the OKEU hospital. There has not been enough consultation, discussion, or dialogue with the people of St. Lucia or other health interest groups on a policy that will affect the lives of all St. Lucians. On 6 June 2016, when the UWP won the election, all equipment had been procured for the OKEU hospital. Work on the counterpart facilities like the kitchen, laundry, and car park had commenced. A contract had been issued for a modern hospital ICT system. Staff and facility orientation had commenced. Testing of the primary systems had commenced, with all electrical, mechanical, and fixed equipment had been tested. Why would the government want to hand over this facility that was 16 years in the making to a foreign private concern? The St. Lucia Labour Party calls on government to halt immediately any plans to privatize the OKEU or health services in St. Lucia and begin immediate and transparent consultation with the health providers and the people of St. Lucia. We will mobilize all concerned citizens to resist any attempt by the government to privatize a hospital that has been the dream of all St. Lucians at home and abroad. The St. Lucia Labour Party also calls on the government to begin meaningful consultation on a universal healthcare system that will allow all citizens of the country access to adequate and affordable healthcare services. I now hand you over to our spokesman for health, the Honorable Moses Shabatis, who will continue our discussion on this rather important issue.